Okay. So, sorry. Mhm. Okay, so let's start. Showing. Let me do the screenshot of those who are present. Okay. So, not yet. Right here. So, okay. So, so the aim of the lecture is to study mechanism of action of modern contraceptive methods and main principles of their use in different lifetime of the woman. So overall, yes, as you remember, fertilization, yes, happens after ovulation. Ovulation happens on 14th day of cycle. Yes, fertilization happens in ampullar part of the fallopian tube, and then fertilized ovum, which is called zygota already, moves, yes, towards the uterus, and on 7th day implants to the endometrium. Yes. So this is just general approach. So different method of contraception can act on a blockage of the ovulation or on blockage of the fallopian tubes, yes, like a surgical sterilization, yes, on implantation, for example, intrauterine device, yes, or they do not allow to spermatozoa to enter, yes, to the genital tract. For example, barrier methods of contraception or chemical spermicides which destroy spermatozoa. So overall, classification of contraceptive methods. I didn't switch on my camera. Ah, 1 second. Again, yes. I'm disappearing, I think. Yes. Just if you cannot see presentation, just tell me by voice. If problem with connection, it is problem with connection. If problem with connection will persist, I will switch off my my camera. Okay, so there are few methods of contraception, natural methods of contraception, which actually are not effective. Otherwise, humanity wouldn't develop new methods, more advanced. I see. Okay, so let me then without camera. Let me continue without camera. Maybe it will be better. Which browser is this? Let me try Google browser. Previously the problem was exactly in the browser. So Yandex browser sometimes doesn't work normally if internet connection is low. So actually the technical support of BSU advised me to use Google browser instead in this case. So let me try to enter through Google browser. It will be better, otherwise it will switch off permanently. So and understand why I don't have option to show presentation. Appeared. Okay, so let's try again with the camera and okay. So natural methods of contraception, which are the less effective methods, barrier methods of contraception, chemical methods of contraception, barrier methods of contraception, intrauterine devices, hormonal contraception. Что ж такое? Сейчас. Again. So without camera. Then. So when I start to give the lecture contraception, it always something happens. Okay, so and surgical methods of contraception. So how can we estimate the efficiency of the contraceptive method? So if we want to compare a few methods, for example, which one is more effective? Which one is more effective? It is like it should be number, certain number to compare certain methods of contraception. So American biologist, not obstetrician, but biologist. It is his name is Raymond Pearl. He studied fertility of the rats. Rats, like the animals. And these rats. So just fertility. And how he counted fertility? He offered birth index. This is the number of pregnancies appeared in 100 females. In his case they were rats. Who used current method of contraception during 12 months. But the index was so effective, yes, so the method was so wonderful, yes, so that obstetricians decided to use it to count efficiency of contraception. So per index give us information how many women become pregnant among 100 of women using this method of contraception during 12 months. Yes, rats didn't use methods of contraception, women use, yes. So in this case, yes, the lower is Pearl index, the better. Yes, it means that, for example, for condom usage, Pearl index is 10 to 15%. Yes, so every each 10th woman becomes pregnant when uses this method of contraception, condom. Yes, but hormonal contraception, combined oral contraception, has Pearl index 0.02 or 0.5. Yes, depending on whether women do mistake in usage of contraception or not. If they do not do mistake, usually it is very effective. Yes, so if women do not forget to use this combined oral contraception, hormonal contraception is very effective method. Yes, so the probability of pregnancy, if Pearl index is 0.5, among 200 women, only one becomes pregnant. Yes, so just compare with condoms. Yes, 10 women become pregnant among 100. Yes, so we cannot say half of the women becomes pregnant. Yes, in 100. Yes, so we say one woman out to 100, yes, will become pregnant if uses combined oral contraception. Okay. So natural methods of contraception, yes, let's discuss them briefly, but actually the humanity developed other methods, right, because these methods, natural methods, are not effective. Yes, they include calendar method, basal chart method, cervical test, usage of ovulatory test, withdrawal, yes, like interrupted coitus, yes, and method of lactational amenorrhea. So withdrawal in meaning of interrupted coitus, not in meaning that they should withdraw from sexual contact. So actually, this is the best method, yes, but we're discussing those methods who prevent pregnancy after sexual contact, yes, not absence of them at all. So calendar method is based on fact, yes, that ovulation appears only in the middle of ovarian cycle, approximately on 11th 15th day of cycle. So in the middle of the cycle, yes, in the middle of the cycle there will be ovulation. Yes, so we suggest that woman can be pregnant only in this time, and in other time she might not be pregnant. Of course, this is not true. This is not true. Why? I had patients who had sexual contact on 5th day of menstruation, and anyway they became pregnant. How it is possible? Because spermatozoa can live like an average 3 days, yes, but they can live also up to 5 days, sometimes even longer. So 5 plus 5 is already 10, and woman might have ovulation on 10th day. Yes, so ovulation can shift a little bit earlier or a little bit later. Yes, so in this case she becomes pregnant in spite that it was right after menstruation or at the end of menstruation. Yes, because of long living of spermatozoa and shifting of the ovulation. So the most safe time, yes, for in this method, calendar method, is last 7 days. Yes, last 7 days. Why last 7 days is most safe time? Because just imagine if ovulation happened and fertilization happened. Yes, how many days does it take for the zygote to reach uterus and to be implanted? It takes 7 days. Yes, so if sexual contact appeared in last 7 days prior to menstruation, it means that when zygote will reach the uterus, it will be already menstruation. Already it will be shedding of the endometrium. So implantation will not happen. Yes. So the most safe time, yes, in this method in reality is last week prior to menstruation. So it means that in the rest of the cycle, women should avoid sexual contacts, which is not actually always possible. Yes. So next method is basal chart method. Yes, basal chart method. And in this method, basal chart method, woman measures basal temperature in the rectum, yes, for 5 minutes, and when she woke up at the morning, but she didn't stand up yet, yes. So as you remember, when it is ovulation, there is decrease of the temperature, yes. So woman measure for few cycles to know when exactly she has ovulation, and she start to avoid sexual contacts like 5-7 days before and 5-7 days after. Yes, so not good idea actually. Yes, oocyte lives sexually for 24-48 hours. Yes, but spermatozoa can live longer. So in combination, this is like should be withdrawal 5-7 days. Yes, not convenient. Yes, and ovulation in in another cycle can shift. Yes, so not good. Not effective. Cervical method, yes, it is based. You remember functional test of functional diagnosis, yes. So when we will take the mucus of from the cervical canal in the middle of the cycle, and we'll stretch this mucus, the length of this mucus will be 10 centimeters. Yes, this is a lot. So in time of ovulation, it will show that it is ovulation. So woman can detect every day the length of the mucus, and closer to the time of ovulation, she should avoid sexual contact. But also, actually, it is not effective method because, again, who knows what is the duration of the life of spermatozoa? It can be relatively long. Yes, time. So this method is not effective. Ovulation test the same. Yes, when woman sees, yes, that second stripe will appear, yes, she will not have sexual contacts, but again, second stripe appears 36 hours prior to ovulation, and spermatozoa, if she previously, when it was just one stripe, she previously had sexual contact, spermatozoa live for 5, in average 3, but we can live for 5 days. Yes, so that's why no sense. Yes, for this method also. Method of lactational amenorrhea. Yes, method of lactational amenorrhea says that if woman has lactation, she might not be pregnant, which is actually also not true. Lactational amenorrhea lactational amenorrhea can be effective if breastfeeding is at least 8 times a day. Yes. So what is the mechanism of lactational amenorrhea? When it is breastfeeding, it is increase of prolactin production. Yes, and prolactin production blocks FSH. Yes, and that's why follicle doesn't grow and there is no ovulation. But for this method, women should have a lot of prolactin. Yes, enough of prolactin to block FSH, follicular stimulating hormone. So it is possible only if it is just solely breastfeeding without any additional meal for the baby. Yes, it is possible only within first 3 or 4 months of life of the baby. Yes, after that, after these 3-4 months, it is not possible. It is not possible, and because already we start to give to this child juice, puree, yes, like any additional food, yes, already. and in this case, yes, already there is a lack of decrease of the milk consumption, yes, and that's why decrease of prolactin production, and woman might become pregnant. And the tricky thing is that ovulation happens prior to the first menstruation, so woman might not have that she has ovulation, and she might become pregnant, and she still doesn't have menstruations, and she's thinking that it is lactational amenorrhea. Yes, she is thinking that she doesn't have menstruation because she has breastfeeding. Yes, but in fact she might already be pregnant. Yes, and she becomes to know that she is pregnant only when she feels the movement of the fetus. Yes, on 20th week. Yes, 18th, 20th week. Yes, so she realizes that she is pregnant with second child. Yes, because she didn't have menstruation again. Ovulation happens prior to the first menstruation during the lactation. So if you see the couples who have children with 1 year gap, yes, between them, these are couples usually who relied on this method. Yes, you should remember that if child already receives any other food or any additional formula, if woman has lack of lactation, yes, lack of own milk, yes, this method will not be effective. There are also other types of legends, yes, especially among teenagers, yes. So that's why we should explain to them that pregnancy is also possible after first sexual contacts, because some teenagers believe that it is not so, yes. Also, in case of a regular menstrual cycle, also pregnancy is possible. Who knows? Maybe ovulation happens even in case of irregular cycle. Yes, and in case of any irrigation after sexual contact, because spermatozoa reach the uterus during 10-15 seconds after ejaculation. And the time, yes, when irrigation will can so if woman even will run after ejaculation to the bathroom, yes, and do this irrigation of the vagina, yes, it takes much more than 10-15 seconds, right? So that's why this method is also not effective. Another thing is barrier methods of contraception, male condom, female methods, female condom, cup, and diaphragm. Yes, so these are very simple methods which create just barrier between spermatozoa and oocyte. Yes, so let's discuss first diaphragm and cervical cup. Actually, when I was student and we studied this method, I was thinking that these methods are just historical. Yes, so nobody uses them. Yes, just in history, because actually in Russia, these cervical cups and diaphragms were stopped to use at 1970s, maybe. Yes. But it appears that in many countries they are still used. For example, in diaphragm is relatively widely used in United States. Yes, like 2% of women uses this method. Yes, so diaphragm just a kind of barrier diaphragm which is inserted to vaginal fornices. Usually woman adds spermicides, yes, to this diaphragm, yes. And in this case actually it is just physical barrier with spermicides which destroy spermatozoa also, yes. So she can insert before sexual contact and remove sometime after that. The same is for cervical cups, but cervical cups are more popular in European countries, like also 2% of women approximately uses them. The size of the cervical cup should be measured and should be so gynecologists should find appropriate size, yes, of this cervical cup for the woman, yes. And she also can put this cervical cup on the cervix, yes, and then remove. So still 2% of women uses this. So use this. Okay, this is condom. Yes, condom is male method of contraception, which is the most popular maybe method of the contraception. Yes, and the wonderful thing about this method is that this method, the condom protects from sexual infections, hepatitis, and HIV. This is the only method. Condoms are only methods which protect against sexual infection, hepatitis, and HIV. If you will obtain HIV, like who will like let's say a lot of women, yes, then regret, yes, they didn't use, yes, and men also, yes. So it is better to think about that in advance, yes. So this is actually my favorite method of contraception because there is no contraindications for that except presence of allergy to latex. which is a relatively rare case. Yes, so it can be used. How can we use the condom? We should buy it only in pharmacy, not in kiosks and not somewhere, because in pharmacy they keep appropriate temperature. Yes, so condoms are made of latex. Yes, and latex is very sensitive to the heating. Yes, so so in the pharmacies they maintain appropriate temperature because they have strict control. Yes, from certain organs. Yes, but in shops, yes, and in kiosks, like previously there were small, very small shops, yes, in Russia, of course nobody maintains this temperature. Yes, so that's why there is another thing, yes, that we should not keep the condoms under direct light and near the source of the heat. Yes, near the heating batteries, near the heaters, on the near the window. Yes, when there are rays, yes, sun rays, which might heat it up. Yes, especially now in spring. Yes, and in summer. So spring starts. Yes, tomorrow. Okay, also, we should not use oil lubricants, yes, just like cream and Vaseline. Instead, we should use water, like water containing gels, yes, special gels, yes, because oils also destroy the latex. Also, another thing, we should accurately rupture package before use. Yes, so we should accurately open these condoms. Yes. Also, do not leave air bubbles in the condom because it can overstretch. Yes, and rupture because it can overstretch and rupture. Okay, female condom. Female condom also is offered as method contraception, and it is registered in 95 countries including Russia. Yes, and this is the only method which doesn't for which it is not necessary to receive the agreement of the man, yes, for usage, but which protects from the sexually transmitted infection. Yes, but it is actually not widely used in Russia. It is not even sold somewhere. Yes, first of all, it is more expensive, like 3 times more expensive than men condom, maybe because of that, maybe because it is not very convenient to use. I don't know. But it is still not used. Only in some countries in nowadays it is used in Scandinavian countries. Yes, in North Europe. Yes, it is sold and used. Yes, but not in other countries. Yes, in spite of that this female condom is registered elsewhere. Okay, spermicides. Yes, spermicides include vaginal tablets, vaginal suppositoria, creams and gels, and sponges. Yes, creams and gels and sponges. So they destroy, like examples. Yes, Pharmatex, Patentex Aval. So these spermicides, they contain usually acidic substances, yes, which destroy spermatozoa. So there might be vaginal tablets, vaginal suppositoria, creams and gels and sponges, and vaginal tablets. So for the thing is that for vaginal tablets and vaginal suppositoria, it should a certain time should pass, yes, before the sexual contact. Usually, for tablets like 20 minutes, for suppositoria like 10-15 minutes. Yes, so it is not convenient. Yes, so that's why you should remember and explain to your patients. Yes, because actually when these tablets Pharmatex appeared in Russia, yes, I remember I was student at that time. It was in mid 1990s, and so obstetricians and gynecologists started to use it and started to be pregnant. Yes, they all become pregnant, but actually they gave childbirth. Our teachers even, yes, because they didn't have. So it takes time, yes, for these tablets to dissolve, and it seems that this time is long, quite long. Yes, it is written like 20 minutes, maybe. Who knows? Maybe it is 30 minutes. Yes, they didn't maintain this time, yes, maybe tablets are dissolved slower than they should, yes, but actually because of lack of the dissolving, yes, pregnancy appeared. So tablets and suppositoria are not good ideas, yes. Creams and gels are relatively good, yes, because immediately after their insertion sexual contact is possible. The same with sponges, like sponge you can insert into vagina, yes, and then you might have sexual contacts for 24 hours, like during 24 hours, I mean, without removal of it, yes, and then remove, yes. So it provides, sponge with this spermicides provides contraception for 24 hours. Okay, another method of contraception is intrauterine device. Yes, intrauterine device, and this intrauterine device is very interesting thing. Yes, there are the first intrauterine device was invented by Hungarian pharmacist Richter. Yes, I think he is the founder of Gedeon Richter pharmaceutical company. So this pharmacist created this device initially from the silkworm, yes, silkworm, but so the intestine, yes, of this silkworm. But in afterwards, yes, other substances started to be used, mostly plastic substances, yes. So what is the mechanism of action of intrauterine device? First of all, it increases contractions of fallopian tubes. Yes, increases contractions of fallopian tubes. So peristalsis of the fallopian tubes is increased, and in this case, even if fertilization occurred, yes, fertilization occurs in ampullar part, yes, of the fallopian tube. If fertilization occurs very quickly, these peristalsis appear, and this fertilized zygota, yes, moves quicker than it should move to the uterine cavity, and when and very quickly removes from the uterine cavity, goes downwards through the cervix, and that's it. Yes, because when zygote passes, yes, if it is quick passage, yes, through the uterine cavity, when zygote passes, it cannot attach, yes, to the uterine cavity, yes, and because at that time zygote doesn't have chorionic villi to attach. So this is one mechanism. Yes. The second mechanism is slowing down movements of oocyte and spermatozoa. So spermatozoa slowly can reach, yes, oocyte. And also intrauterine device always lead to sterile aseptic inflammation, even in absence of infection, yes, because actually intrauterine device is foreign body, yes, foreign body, and intrauterine device always has reaction, yes, from the side of the immune system, yes, so there are a lot of neutrophils, macrophages, T cells, the natural killer cells, they all come to remove this foreign body from the organism. So it is always sterile inflammation in the endometrium against this foreign body, yes. So this is actually the mechanism, yes, and this mechanism inhibits implantation. That's why I don't like intrauterine devices. I never recommend intrauterine devices because it is always inflammation, especially, in my opinion, they should be prohibited for those women who have never been pregnant, who are planning pregnancy, because a doctor artificially creates by his or her own hands inflammation in the uterus, yes, and then we will treat infertility, yes. So, but I actually don't like to use them even if woman finishes her reproductive function. Why? I can explain that. So overall, to explain that, I should explain the mechanism, yes, of the insertion, yes, of the intrauterine device, yes. So intrauterine device should be inserted on 5th day, yes, because in 5th day cervical canal is opened, yes, and doctor is sure that patient is not pregnant, yes. So when we insert this intrauterine device, yes, it is folded. Yes, so we first of all by special probe we measure the length of the uterine cavity. Then we insert intrauterine device. Yes, and then we remove this conductor. It is called. Yes, and then intrauterine device become opened. Yes, and it retains in the uterine cavity. Yes, but every intrauterine device has such threads. Yes, these threads are necessary for removal, yes, of this intrauterine device from the uterine cavity, so doctor can pull and take it off. But the thing is that these threads can be the bridge for the infection. Yes, the bridge for the infection. So there might be ascendance of infection upwards, yes, from the vagina, yes, to the uterine cavity. And in the uterine cavity, it can be endometritis, and then it can be even ascendance of infection to the fallopian tubes, and it can be salpingophoritis to Bavarian abscess, and so on. Yes. Okay, so let's do 5 minutes break, yes, and then we will continue where we are with hormonal contraception. I hope now you can see, right? Now you can see presentation if I switch off my camera. Oi, sorry, I didn't shift the language. Okay. Okay, so let's continue. Hormonal contraception. Yes, it is the most effective method of contraception. Annually, 120 women worldwide use hormonal contraception. So overall, yes, we can conditionally divide contraception into two parts. Yes, first is oral hormonal contraception. Yes, which includes tablets. Yes, and other methods of hormonal contraception are called parenteral methods. Yes, so we do not take any tablets per OS, but there is another type route of access of this medication. So they might be injectable, such as Depo-Provera, for example. Yes, implantational, such as Narplant and Implanon. Yes, a vaginal ring, NovaRing. Yes, when we insert the ring into vagina. Yes, and it releases hormones, and contraceptive patch Evra. Monophasic pills. Each tablet contains the same amount of estrogen and progesterone. Yes, and these medications can be taken from first day of cycle during 21 day and 7 days interval for menstruation. So they mimic normal menstrual cycle, 28 day menstrual cycle. So if we will take the package, we will see that in every tablet the amount of estrogen and progesterone is the same. That's why they call monophasic. Yes, absolutely same tablets in whole package. Yes, triphasic pills. Yes, biphasic actually only Antavin nowadays. It is not used. Yes, let's say like that. Triphasic pills contain in each package there are 3 types of pills containing different amount of estrogens and progesterone. Yes, so actually it is closer to physiological cycle. I don't know why they're not so widely used. Yes, so in first group of pills in the package, the amount of estrogen is relatively high, amount of the progesterone is relatively lower. Then second type, the decrease of estrogen, slight increase of progesterone. Yes, and then in third type of the tablets, progesterone is completely increased. Yes, more than previously. Yes, and estrogen is a little bit more decreased. So triphasic pills also can be taken from first day, yes, during 21 day with 7 days break. Okay, mini pills. Yes, mini pills contain only progesterone without estrogens. They can be used from first day of cycle during 21 day with 7 days break or continuously in case of absence of menstrual cycle during the breastfeeding. Okay. So what is good concerning mini pills? Yes, as they do not contain estrogen, they contain only progesterone. In this case, they can be used by those patients who have contraindications for combined oral contraception. So combined oral contraception contains 2 medications. Yes, estrogen and progesterone is just Irina, Jasmine, Jas, yes, Jess, and so on, Navinet, and so on. Mini pills, Cherazeta and Dexcliton, they contain only progesterone, so they can be used for patients with who are smoking. Yes, for example, who are older than 40 years old. Yes, they were the high risk of the thrombosis, for example. Also in obese patients, yes, in patients with hyperprolactinemia, also in those patients for whom estrogens overall are contraindicated. Yes, such sometimes even in case of lactation. Yes, for example. Another method is the Depo-Provera. Yes, it is injectable medication containing progesterone. Yes, injectable medication containing progesterone. Nowadays, so this injection provides contraception for 3-4 months. But nowadays it is not used because
often in case of usage of Depo-Provera, there can be acyclic uterine bleedings. Yes, so that's why in Russia we stopped to use it like 20 years ago for contraception, and actually overall we stopped to use it. Yes, but in some countries it was recommended like until recent times. Yes, only a few years ago it was official notification that indications for Depo-Provera are not contraception. Yes, so it is progesterone actually, so that's why it can be used for the treatment of endometriosis and fibroids. Yes, but for which actually is not done. Yes, it is not used. But for contraception it was completely cancelled. Yes, a few years ago. Narplant is implantational contraceptive containing progesterone. So these are silicone capsules. Yes, it depends on Narplant. Also, Implanon, another medication. They can be inserted, yes, for the period of 3 or 5 years, and they release progesterone, and actually quite effective, good method. Women should not think about contraception every minute. Yes, for 5 years everything is okay. Contraceptive patch Evra. Yes, this patch actually is used for the contraception. It is combined. Yes, so for example, Narplant is not combined. Narplant contains only progesterone. Yes, contraceptive patch Evra contains not only progesterone, but it contains a combination. Yes, combination of of estrogens and progesterone. So in the package there are 3 plasters. Yes, 3 plasters, and each plaster should be used for 10 days. So woman can glue, yes, this on the skin. Yes, and within 10 days all these estrogens and progesterone, they will be released. Yes, after that she should remove this plaster. Yes, and glue another plaster. Yes, and then another one. Yes, so in total not 10, 7 days, sorry. So 7 multiplied by 3 is 21 day. But if woman will forget that from where I remember that, if woman will forget to remove this plaster after 7 days, the action of the plaster is 10 days. Yes, so maximal action is 10 days. Yes, so if she will forget on 7th, she can remove on 9th day, for example, and everything will be okay. Yes. So after the usage of these 3 plasters, she can wash. Yes, she can take the shower. Yes, with these plasters. Yes, they will not glue out. Yes, by themselves. Yes, so that's okay. And after the usage of these 3 plasters, she can have break. Yes, for 7 days, and during these 7 days, shedding of the endometrium starts. Another thing is Novaring. Novaring is hormonal ring containing estradiol and progesterone, which can be inserted into vagina for 21 days and then 7 days break. So this hormonal ring also releases estrogens and progesterone. Yes, but it is local. The amount of estrogen is just 15 microgram. So if just do not mix this Novaring with diaphragma. Yes, because it looks a little bit like diaphragma. Yes, so diaphragma is just solid, yes, formation which we insert into vaginal fornixes, and it provides mechanical barrier. Yes, here our vaginal ring doesn't provide any mechanical barrier. It is real ring, so it is the hole. Yes, inside. Yes, the hole inside of it. Yes, so we just insert this ring into the fornices of the vagina. Yes, and it releases hormones for 21 days. Then we should remove this ring, yes, and then 7 days break happens. We should understand that this ring is disposable, yes, because some women want to insert it few times, few months, yes. No, one ring can be used only during 1 month, yes. After that, it should be taken out and thrown out, yes. Okay, so but overall, yes, it is actually combined contraception, but for which more convenient usage, yes, which is like intravaginal. In my opinion, I had such patients. I do not prescribe this vaginal ring because actually this is foreign body in the vagina, yes, and microorganisms start to persist, and it is colpitis, yes, like they very often they have colpitis, which can be treated only when we change the method of contraception. So actually, for me, this contraceptive patch Evra is more convenient rather than insertion of something into vagina. So this contraceptive patch Evra, yes. Also, you if you are afraid that you will forget to glue out, yes, to take out the one patch and put another patch, there is also application for mobile phone which will remind you, yes. Sorry. And concerning Novaring, it is the same. You might also upload application, and application will also remind you when to insert this vaginal ring and when to take it out. Okay, surgical sterilization. Yes, another method is surgical sterilization. This is a reversible method. Yes, especially female surgical sterilization. And this surgical sterilization is tubal ligation or coagulation in females. In females, yes, and male ligation of seminal ducts. So not in all countries, yes, it is widely used. It is a very popular. Female sterilization is very popular in United States in women after 40 years old, yes. And in male sterilization is popular in China, yes, because in China it is very high fine if where you have a second child, yes. So nowadays, for those people who were second child, who were the only one child, yes, it is allowed to have 2 children, yes, but so not for all, yes, but previously, yes, they were very large fines, yes, for the second child, yes. So that's why, and man was responsible, yes, for payment of this charge of this fine. Oh no, there's any reparation somewhere. And that's why in China it is popular method, male sterilization, yes. Another thing, yes, so not in all females we can do sterilization, yes. So usually in majority of countries women should have children, yes, and should reach certain age, yes, to have surgical sterilization. So in Russia, women should be at least 35 years old, yes, and have she should have um, at least 2 children, yes, and she should write application by her own hand, yes, complete application, yes, for surgical sterilization, yes, because it is very serious thing, yes, surgical sterilization, it is very serious thing. Okay. So there are 2 types, yes, of surgical sterilization in females. First is laparoscopic sterilization. This type we can do if woman is not pregnant. Yes, so she can come to the gynecological department and ask for surgical sterilization. Yes, and it's second is surgical sterilization after any abdominal operation, usually after cesarean section. Yes, so if, for example, woman has third childbirth, yes, and she is 37 or 40 years old, for example, yes, and she can apply for a surgical sterilization together with cesarean section. If we do cesarean section, yes, we can do surgical sterilization. So in this case, we can apply ligatures on the fallopian tubes, yes, on the fallopian tubes, and in this case, we can just yes, do it simultaneously with C-section. There are few methods, yes, of the sterilization. First method is Madlener method. Yes, we used it previously when we just put ligature, yes, ligation on the fallopian tube, but very often recanalization occurred, yes, and restoration, yes, of the passage, yes, they become pregnant. So that's why we use modification, Kocher modification, when we not only do ligation of fallopian tube, but we also cut fallopian tube to prevent recanalization. Surgical sterilization of men is just dissection of vas deferens, ligation and dissection. It is believed that in men sometimes we can do reversible. Sterilization. Yes. So in this case, we can sometimes restore to do plastic of these ducts. Yes. And restore the passage, yes, so it is not obligatory forever, yes, but it is sometimes technically difficult. Okay, so let's talk also about urgent contraception. This type of contraception is not very good idea actually, because it changes sufficiently, yes, hormonal balance in the organism, yes, and it is relatively dangerous for the woman. So you cannot use it like for more than once a year, yes, or it is better to not use it at all, yes. So it is only for some unexpected situations, yes, such as for example, rupture of condom, yes, or any violence, yes, some unexpected thing, yes. But you should not use it as routine method, yes, it is very dangerous, very dangerous. Okay, so hormonal contraception includes tablets with high level of progesterone, which is Postinor and Escapel, and we will discuss how to use them. USP regimen. USP means regimen means that we can take, if you don't have Postinor and Escapel, special tablets for urgent contraception, you can take usual combined oral contraceptives and take few tablets. Yes, and we will also discuss how. Another thing, yes, is usage of progesterone antagonist, mifepristone. Yes, so it blocks receptors to progesterone. Uterus is not relaxed. Yes, and if pregnancy appears, it is just expelled. It is just expelled. And what is the sound? And third method is insertion of intrauterine device. Intrauterine device can be inserted 5 days during 5 days after the sexual contact to prevent future implantation of embryo. Yes, this can be the urgent method of contraception. Medications for urgent contraception include Postinor. Yes, so Postinor contains only progesterone. Yes, there are in the package there are 2 tablets. Yes, Each tablet contains 750 micrograms of progesterone. Yes, women should take these two tablets with 12 hours difference, and last tablet, second tablet, should be taken not later than 72 hours after the sexual contact. Escapel has one tablet where it is just one tablet but with 1,500 micrograms of progesterone, and patients should take only one tablet. Actually, there are more side effects from Escapel rather than from Pastinor. What is the mechanism of action for this urgent contraception of this high dosage of progesterone? If this sexual contact happened prior to the ovulation, first half of menstrual cycle, progesterone, by the negative feedback, blocks luteinizing hormone production. Yes, so do you remember that what is negative feedback? If we have a lot of progesterone, it then what happens? Premature menstruation starts, yes, because you remember that shedding, yes, of the endometrium occurs when progesterone level drops in 30%. So when we use high dosage of progesterone and then stop to use high dosage of progesterone, there is high difference, yes, between large dosage of progesterone and decrease of progesterone. So in this case, a patient will have premature menstruation. Yes, and that's why if fertilization appears, anyway, it will be miscarriage. Yes, not miscarriage. Anyway, it will be no implantation. Yes, USP method. Yes, if we don't have these medications, for example, in the pharmacy, we can take combined oral contraceptives and look on the package. Yes, how many micrograms of ethinyl estradiol each tablet contains. Yes, so women should take 100 micrograms of estradiol, of ethinyl estradiol, yes, at once. And after 12 hours, repeat, yes, this amount of tablets. And the last dosage should be taken not later than 72 hours after the sexual contact. So, for example, Navinet contains 20 micrograms, yes, of ethinyl estradiol each tablet. So woman should take 5 tablets once, and after 12 hours another 5 tablets, like half of the package. Can you imagine, yes, what is the large dosage, yes, of the hormones are in these urgent contraceptive methods? So that's why it is not an innocent thing. Yes. Okay, let's discuss different types of contraception for different years. For example, in adolescence, yes, I found recently very ridiculous thing. Very ridiculous thing, and this ridiculous thing is that, for example, American Association of Pediatricians, because in United States children considered as adults after 21 years old. That's a lot, yes. Before 21, they are treated by pediatricians. So American Association of Pediatricians recommend as a main method of contraception intrauterine device. Actually, in my opinion, it is crime against the nation. Yes, because I already explained that intrauterine device, even in case of absence of microorganisms, provides sterile inflammation, which future can lead to infertility. Another thing, adolescents might pick up infections, yes, and if they have an additional intrauterine device, this infection can ascend to the uterine cavity, and there will be even tubovarian abscesses, which might lead to the removal of fallopian tubes and even ovaries, yes, in teenagers. So it is insane. Yes, do not repeat such mistakes. Yes, I don't know who is the head of this Pediatrician Association of United States, but I believe that person is criminal. Never use intrauterine devices in adolescents, yes, and I wouldn't recommend to use intrauterine devices even in young women before they had labor, yes. It doesn't matter whether they're adolescents or they're already adults. So what are best methods of contraception for adolescents? First of all, these are condoms, yes, because they provide not only protection from a pregnancy, but they provide protection from sexually transmitted infections. Spermicides, yes, but their efficiency is low. Actually, this acidic medium, which is created by spermicides, also a little bit provides protection from infection, but not as high. Of course, it is better to combine spermicides plus condoms. Some condoms contain non-xenol spermicide, yes, so it provides better protection against infection and pregnancy. Also, we can use hormonal contraception with low amount of estrogens, but after at least of 2-3 normal menstrual cycles. And this or also double Dutch method is existing. Yes, it is something ironic, yes, in the name of the method, because double Dutch means something ridiculous, yes. In English, this is idiomatic phrase, yes, double Dutch. But anyway, double Dutch method, it is suggested that it is double method, which was invented in Holland, yes. That's why it is called double Dutch. And this method this method includes simultaneous usage of combined oral contraceptives and condoms. So condoms protect against infection, and even if condom will be ruptured, pregnancy will not happen because the girl uses combined oral contraception. Yes, contraception after 40 years old. After 40 years old, we can use intrauterine devices, yes, gestogen-containing contraceptives such as mini pills and Norplant, because actually after 40 years old, there is higher risk of thrombosis, yes. Also, we can use condoms and spermicides. Contraception after the labor. Yes, after the labor. As you remember, during the 6 weeks of labor, the involution of the uterus happens. Yes, and during 6 weeks after the labor, it is not allowed to do any to have any sexual contacts, yes. So it should be sexual continence, yes, because any infection, yes, which appears inside the genital tract can lead to endometritis and sepsis. This is serious thing, actually, yes. So that's why we write, when we discharge woman from the hospital after the labor, we write that she should avoid sexual contacts during 6 weeks, yes. And after 6 weeks after the labor, yes, we can use mini pills which are not containing progesterone. Yes, they contain which are not containing estrogens. They contain only progesterone in constant regime, and they can be used, yes, because they do not influence to breast milk production. Estrogens they might block, yes, if it is combined oral contraception. Estrogens can block breastfeeding, yes, lactation. But if it is mini pills, they usually do not block. But you should understand that actually progesterone can appear in the milk, the breast milk, yes. So in spite that it is proved that it is safe method of contraception, I wouldn't recommend this. Yes, who knows what will be in the future. Then spermicides, yes, also can be used. Condoms can be used, and intrauterine devices. But intrauterine devices we can insert only from 4 to 6 months after the labor. Yes, not right after the labor. Yes, because right after the labor, uterus doesn't yet have involution. Okay, thank you for your attention. Does anybody have any questions? Doing screenshots when we finish. No. Okay, thank you for your attention. Have a good day. You are welcome. Have a good day and have a good weekend. See you during the semester. Bye for now.